Thank you, Dr. Sandeep Sarel and Sahani sir.
Thank you, sir.
Good evening, good afternoon, and good morning. This is the 1525th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Mukesh HEMRAJ PAREWAL. Let us begin the session with 1 minute. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have three sessions every day. The first session of the day is already over. The Hindi session from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and 9:30 to 10:30 we have the local language session in Malayalam. All these sessions are going in a good way, and we are uploading the same videos of the same on the very next day itself, so that people can watch it again and again, and you can subscribe the same without paying a penny. This is all about the International Forum. We have doctors from 85 countries are presented different papers on different subjects, and all these papers are really exemplary, brilliant one. And today, let me introduce the guest of the day is none other than Dr. Mukesh HEMRAJ PAREWAL, has completed MD and working as the Associate Professor, Department of Physiology and including Biochemistry at KB, Srimati KB Abad Homeopathic Medical College, Chandwad, Aurangabad, and has a working experience of 22 years teaching, and clinical experience of 22 years also. And he is a moderator, examiner, center change, and a coordinator, and so many. He has undertook so many research projects, and as awarded so many awards, as well as winner of many awards. And he has written an autography, The Way of Regeneration of Vital Info, volume 24, in December 2026, and so many important articles were written, and all these things were really a very good one. Today, Doctor will be discussing about skin mirror of mind, cure by homeopathy. That is a very, very important subject, as we know that the skin is the external manifestations of the internal disorder. So let us welcome the guest of the day, Dr. Mukesh Parwal. Welcome, sir.
Thank you very much. Thank you very much. Am I audible, sir?
Yes, everything fine. You can go ahead, sir.
Thank you, sir.
Yes, that's lives also.
Yeah. So, what is the purpose of today's session is, as we follow our holy religious book, through that holy religious book, we get the right path in the life. Otherwise, we will be in confusion, we will wonder. So, like in homeopathy also, we have a simply follow our master, Dr. Samuel Hahnemann, and his organon of medicine. If we follow organon of medicine, then sky is the limit for success in our practice. So whenever we want to think about skin and we want to cure skin issues with homeopathy, everyone should know aphorism number 204 and 205. It is mandatory to know aphorism number 204 and 205. If you know these two aphorisms, all these cases of skin, not only like Dr. Sandeep right now said about psoriasis, but even eczema and so many other skin diseases you can cure if you know aphorism number 204 and 205. So according to these aphorisms, all chronic affections and the diseases properly so-called must be cured only from within. If you will not cure skin diseases or any diseases from within with the homeopathic appropriate medicines or with the miasm underlying at their roots, that disease cannot be removed from the body. So these aphorisms, what it says that whenever you want to treat any disease, that disease should be treated internally from within, not just by giving the medicine from the outside. Then only by the disappearance of the totality of symptoms by the cure, affection of the vital force, that is to say, whole internal and external morbid state is removed. So let us begin with one case only. Then we'll go in other discussion, because already I think discussion has been done on what is skin diseases, what is psoriasis, what is eczema, what are the causes, what are diagnoses, and so many things which are available in textbook also. The cases which I am presenting here, only few cases. Those cases are from my own clinic, and those already been published in some of the international and national journal also. So let us study one case of tinea capitis. As every disease taking its location on the skin, so tinea capitis is also coming on the skin. So tinea capitis attended in my private clinic. It is diagnosed on the basis of course, symptoms. Detailed case history is taken and repertorization is done through the radar opus software. Now, you know very well, tinea is a generic term given to class of cutaneous affection that owes there are to vegetable origin of trichophyton. Its synonym is ringworm, or you can say it is a barber's itch also. Barber's itch is the direct rubric also is there in the repertory. So basically it is a cutaneous affection of the skin of origin of trichophyton, and its synonym is ringworm, commonly known as a ringworm or barber's itch. Dermatophytes are the fungi which are capable of skin infection, which is known as ringworm or dermatophytosis. Of course, causative agents are fungi, which are microspore, trichophyton, then epidermophyton. They can originate from soil or animal or be confined to human skin. This is, of course, fungus infection, which is most irritating and long-standing. Many times before reaching to us, modern medicine used by the patient make the cases worse. Because, patient come to the homeopathic physician with, the case is full blown with many symptoms. The patient will not come in the very first instance. So when patient comes to us, already have taken the allopathic medicines, and allopaths have worsened the cases, and the patient want to get rid from that basically itching and cosmetic issues related to it, so that this need to be treated. Basically in any of the skin diseases, two things are very much essential, that usually patient complaint of itching, and they have the problem with the cosmetic approach, that the thing is not looking good. So these are the two main issues. And the third issue is that he is coming to us with the case worsen, because he have taken the many of the allopathic medicines, he have applied the ointments and so many other things, he have taken steroids and all those. So already the case which come to us, either of fungus infection, either of viral skin infection or any skin infection, it will come with the worsen by the allopaths or even by the some homeopaths also. And patient is complaining of itching, and of course he is having a cosmetic issue. According to homeopathic principles, symptoms are reflections of something wrong happened inside. That we know, everyone. Whatever symptoms are coming are the reflections of something wrong happened inside the body, which is to be corrected, and need to find out why this has happened, why the patient is coming with that symptoms. Because basically when, according to 204 and 205 aphorism, when we are saying that the reflection of whatever symptoms is because of something bad or wrong happened with the person as a whole or with the patient as a whole, then we need to find why this has happened. So when we need to find why this has happened, we need to be treated a case with the holistic approach, and holistic approach is only given in the homeopathy. So we choose homeopathy, where we know for as we know, genome is responsible for our physical makeup. Whatever we are, like my nose is very straight, it is because of my genome. Genome is responsible for physical makeup as well as mental makeup and general makeup. So all with the physical makeup, mental makeup, and general makeup, with all these three, we become as a whole. So we have to treat physical, mental, and general. So all these are taken into account for prescribing in the mind for prescribing the individual so as to reach to the constitutional semi-minimum. So whenever we need to treat the patient, we need to give constitutional semi-minimum, and when we need to give constitutional semi-minimum, we have to consider physical makeup, mental makeup, and general makeup. Of course, there are certain cases where you can only think of mental makeup, you can only think of physical makeup if you are expert in that. Otherwise, if we are not expert according to 204 and 205, we need to have a physical makeup, mental makeup, and of course general makeup. So we take all these into account for prescribing the individual so as to reach the constitutional minimum. We can easily crack the cases. So now let us discuss one case. After discussing case, I'll be very happy if any of the participant can throw light on that case. Case history is Mr. YB, his age is 30 years. He came up with the following complaints, where he's having a hairless patch on occipital and temporal areas of scalp. There is slight itching over the area for 6 months, and he is having knee joint pain, especially right. So I'm again reading chief complaints. Patient is of 30 years age. He is having hairless patch on occipital and temporal areas of scalp. He is having slight itching over the area for 6 months. And of course, he is having another complaint also, that is knee joint pain, especially right knee pain. Mind and life space. Patient is art teacher in school, very good artist. He is making sand design and various artistic articles. So basically, he's an art teacher, drawing teacher, art teacher, you can say. Patient narrated that his father was very strict. While I was taking case of that patient, he told me that his father was very strict and dominating towards all in the family, not only with the particular with the patient, but with all in his family. He was very dominating. His father always quarreling in family on a slightest matters. Later, his father left the job and all the responsibility come on his head, on the patient's head. So he took all the responsibility. He's trying to fulfill all necessary requirements of family as he's only son, he's only person in the family who is earning for the family. So he told he developed anxiety because of all this matter. So I think case is clear. Father and mother always used to fight very often in front of him. Father used to quarrel with him also, not only with his mother, with him also, but he tolerated all. He has to understand all the family members. He's having sisters also. Due to all these issues, he was unable to concentrate on his career, where he was having artistic mind. He is artist, he is painter, where he wants to grow in his own field. But because of all this responsibility, he was unable to do so. Patient was telling during case taking how he have made sand painting. He have brought that sand painting to show me. During that consultation, patient was showing that sand painting, various articles, and those paintings were very different from usual, and they were very good. He is in very much demand for all his art, but according to him, he is in very much demand for all his artistic activities. People are purchasing all those artistic activities, the posters, painters, various sand paintings, and all those. The people are purchasing from him, and the people are giving orders to him. What he was telling to me. Patient was very modest. He was talking very nicely in a very proper tone and with all good gestures, and he was very humble. Patient was continuously telling about his career, art, how he is making the art, about his sand paintings, about his paintings, about his normal paintings, how he's selling his paintings and all those he was telling me continuously during the conversation. Along with that, he already told me that how his father is dominating, then how his father is quarreling with the mother, how he has to take the responsibility, and because of all these situations, he cannot concentrate on his job, on his career, where he want to grow in his own career. He was telling he want to focus on his art and want to grow in his career, but he is unable to do so. These are physicals: appetite good, thirst, thirstless, craving, nothing specific, urine normal, stool normal, perspiration normal, sleep normal, thermal, tolerate cold but cannot tolerate heat. So you can say it is towards hot. So this is the case. I think case is clear, everyone. Case is clear, everyone. Anyone can answer, please. Have you listened the case? So the learning should be two-way. Case is clear to everyone. You can unmute yourself, anyone, and can tell me. Case is clear. If you have any doubt, you can ask me in the case. Then we'll go ahead. I think case is clear. If nobody is talking or nobody is sharing. Now see the point of making diagnosis. In previous session, Hindi session also, we have discussed why we need to diagnose the case. It is not so we are homeopaths and we should not diagnose the case. It is not so. Point of making diagnosis is to improve your predictive ability about the course of disease in that particular patient and its likely response to treatment. So why we need to do the diagnosis? It has been said that many homeopaths, there is no need of diagnosis. It is not so. When we are diagnosing the case, that means we can develop our predictive ability about that particular disease, about the course of the disease. Here in this case, which right now I have narrated you, here case diagnosis is done on the presentation where small areas of scaling, circular fairy ring and patch of alopecia at affected area, that is already I mentioned, occipital and temporal region, there is a patch of small areas of scaling, circular fairy ring. So it is ringworm, what we have diagnosed. Now as case is slow developing, psychotic miasm as per physical and mental presentation. So considering disease diagnosis as a tinea capitis and psychotic symptoms, we can drag down to reach the constitutional semilimum. So before going further, anyone want to share what must be the remedy, what must be the rubrics or anything you want to share? Then we'll go ahead. I think case is clear. If case is clear, if anyone want to share what must be the...
Yes, sir. Everybody can give their answer in chat.
Acha. Okay, okay. It is better if they will talk one-to-one.
Sir, then our Zoom will be disturbed, sir. That's
Yeah. It's okay. Any one or two. Those who
if,
want to say about this case.
if anybody want to say anything, you can raise your hand and
Yes, please. If you want to say about which medicine is there or anything you want to say about case, any idea about drug remedy? Any idea about remedy? I already told you case. A 30 years old person who is having very dominating father and he have to take the responsibility. He is having artistic mind. He is an artist. He is a teacher. All this, and he is having tinea capitis. Okay, I think we'll go ahead.
sir, there are two medicine carcinosis like sodium.
Okay. Sir, why carcinosin?
Yeah. Dr. Jayalalitha, tuberculosis, cervical nature mode, cervical lycopodium, like people are writing. So please go ahead with the session, sir.
Okay, okay, sir. I think you can see a screen now again.
Yes, yes, yes. The first page is there.
Yeah, I'm just making it. So I have taken these symptoms for the repertorization as per my understanding. Elements from domination. He is ambitious. Anxiety, family about his. He was boastering. He was telling, in between, I'm doing this sand painting, I am this, I have done this, and all those. So I have taken the boaster bracket. Want of self-confidence, because he was telling ki whether I can do it or not, people will take from me or not. He was telling that also. He was very mild and modest. He was talkative continuously. He was talking. Eruption, ringworm, hot patient, and thirstlessness. So if you see, I have taken mental general, physical general, all the things I have taken. Remedies after repertorial filter, Lyco, Calcarea carp, Aurum mur natrum, Ars alp, Silicia, natramur, sulfur, pulsatilla. Repertorial totality gives mainly following remedies after thermal thirst filter. I have put the thermal thirst filter. So there are three remedies comes, that is Lyco, sulfur, and pulsatilla. So lycopodium is marks 7 out of 12, sulfur 6 by 10, and pulsatilla 6 by 8. Justification of remedies. Calcarea, natrum, silicia are chili remedies. What happened? I think some issues are. So Calcarea, natrum, silicia are chili remedies, whereas pulsatilla is not ambitious like Lyco, as well as it's ambithermal, very timid. What happened? I don't know. Just wait. There may be some technical issues here. So pulsatilla is not ambitious like Lyco, as well as it's ambithermal, very timid, whereas patient is mild but very firm and taking all the responsibility of families. Sulfur is living in his own world. Something is Sulfur is living in his own world through creative, though creative, whereas patient concerned with family and not as mild as Lyco or pulsatilla. He is confident like a sulfur. Confident of sulfur is not weak as Lyco or pulsatilla. So, with all this discussion, if you know all this discussion, I prescribe Lycopodium 200 single dose on the basis of thirst, thermal, and ambitious, want of confidence, elements from domination. So I prescribe Lycopodium 200 one dose according to repertization result and comparative study from the Materia Medica. So if you see, so we were having three medicines actually, Lyco, sulfur, pulsatilla, out of which I told you on the basis of thermal thirst, confidence, responsibility, and domination, I have prescribed with this chart Lycopodium. And you can see, if you can see, this was the patch previously. This is the patch. Everyone can see. And here, see, there is no patch. Clear. Patch is clear. See. This tinea is clear. It was here, here, here. The same picture. Clear. You can see the difference because of Lyco. See. This was previous picture. And this has been clear within few doses only, whereas he was already taking the allopathic medicines and all other traditional medicines. From even he have taken some medicine from the barbers also, but still it was not going. So you can see this case. Okay, this was the case of tinea. This is how it get cleared. This was the patch. This is completely cure and clear. And after that, patient did not turn into my clinic, unfortunately, but he called me that, sir, I got relief from your medicines. I told him, kindly send me the picture. He sent me the picture. And one more thing, he told me that, sir, now I'm taking the responsibility. After 1 or 2 months, he called me and he told me, sir, now I'm taking responsibility, which previously also I used to take. But now I'm taking the responsibility with cool mind. Now I don't take any stress of my father, who is always fighting with my mother or who is always fighting with me. Now I am dealing all the responsibility with the cool mind. So see the difference. Not only the patch has been disappear, but also the mind also get clear. Mind is also okay with our homeopathic medicine. Now we'll go to the another case. If you have any doubt, any query regarding this case, you can ask me.
Sir, we can have discussion in the last part.
Yeah, yeah. Okay, sir. Okay. I'll go to another case.
Yes.
I'm just sharing. Give me. You can see.
Yes.
Okay. So why I told that skin is a mirror of mind? You see, in last case where we have studied that whatever things has been happened with that individual, that person, all that has been reflected on the skin. His disease, he talked, is all mind set up with the through the skin. Whatever things has been happened, that is reflected on the skin in the form of tinea capitis, in the form of ringworm, and we treat ringworm, and we along with that we have also treated his mind and physique. So I was saying that skin is a mirror of mind. Now another case. Patient is farmer, 26 years old male from joint family. I'll just check it whether in his issue. Patient is farmer of 26 years old male from joint family, very much pampered, so-called ladla by grandparents and parents also. So he was very much attached to grandparents comparatively. Relative of local politician, talking how he was doing farming, taking efforts for farm, asking to cure him as early as possible. He was telling me, Doctor Saab, please jaldi se cure kar dijiye, as he wants to look after his farm. But due to skin eruptions, he was unable to work in the farm because eruptions are very much itchy, telling how he is concerned and careful about his grandparents. He become irritable during his sickness. Even he gets simple fever, he get irritated. While narrating complaint, he was smiling and gestures are like a shy boy. Telling during history, he has to work more because during his sister's marriage, his parents took loan. So now he has to work more in his farm to repay it. Who will do that? Asking in how much time eruptions will disappear. So this was his mind and life space that he was very much attached to grandparents. Rather, grandparents are very much attached to him. He is a ladla of his family. He is having influence of local politician. He is doing farming. He want to do more good in the farm, but he is unable to do so because of very much itching, because continuously there is perspiration, and because of perspiration he is getting itching. He is concerned and careful about his grandparents very much, and whenever he get sickness, any even simple fever, he get irritated. And when he was talking, he was continuously smiling and giving gestures like a shy boy. That was my interpretation. Telling during his history, he has to work more because during his sister's marriage, his parents taken the loan, and now he has to repay that, and for that he has to work hard in the farm. Just wait. You can see screen.
Sir, please reshare, sir.
Okay.
Screen and off now.
Acha, reshare. Okay, okay. Now you can see.
Yes, yes.
So this was his mind and life space we have discussed. Then his physical appetite good, thirstlessness, craving nothing, urine normal, stool sometimes constipated, otherwise okay, perspiration normal, sleep on back, sound sleep, past history, no any specific. Family history, father and siblings, no any specific history, like diabetes, hypertension, or something like that. I say it's nothing any specific. So now again, I will give some time. If you anyone want to say any medicine, remedy name, any judgment, any idea. Anyone?
Ganesh,
Please, sir, anyone? Any idea? Okay, we'll go ahead. So I have taken the rubric mind, elements from embarrassment. See, the first case, when I was in my clinic, the first case I have taken all the physical, mental, and general symptoms all together, and I prescribed lycopodium for tinea capitis. In due course of time, I have been attracted towards the mind method in between, and in Nasik, Dr. Liaquat Namole is there,
two
who is
medicines are
conducting
written. Sir, two.
various sessions, and then I started working only on the mind symptoms, Saigal method. So this case I have solved with that method.
Sir, two medicines were written. Pulsarla agnesia.
Okay, sir. Okay, yes, thank you, sir. So rubric repetition, mind, elements from embarrassment. Why I have taken the embarrassment? While narrating, patient was bit smiling. So that is a typical embarrassment while narrating complaints. So I have taken that. Just wait. Then
Mind effeminate.
Next. Sorry, sir.
Mind effeminate.
Yeah. Second symptom I have taken mind effeminate, because when he entered in the clinic, that typical his entrance was like a effeminate in a effeminate manner, like any, like a female is walking, though he's a boy or male. Then continuously he was talking about his farm work. I have to do farming. I have to look after farming. I have to earn money. I have to repay the loan. So I have taken talking business off. Then while complaints, he become irritable. During fever, he become irritable. So I have taken irritability, heat during. Then sleep position on back, and symptom skin psoriasis. That cases of psoriasis. Remedies after repertorial filter. There are three remedies after repertorial filter: pulsatilla, sulfur, and phosphorus. So now actually when I have taken the case, and now I am presenting the case. While presenting the case, I have make it simplified so people can reach to medicine. But when I was taking when I was taking case, it become very difficult to reach to that all the things. I have compile here, and then I am presenting in front of you, so it become easy for everyone, probably. So remedies after repertorial filter: pulsatilla, sulfur, and phosphorus. Now justification. The disposition and mental states are the chief guiding symptoms to the selection of pulsatilla. I have given the medicine, as someone said rightly, pulsatilla. I prescribe pulsatilla 201 dose. And to my wonder, previously, I also used to give the medicines in the repetitions and this and that. But once I connected to Dr. Liaquat Namole and Saigal's method, then I start with the confidence. I'm started using single medicine, single dose. So here also I have prescribed pulsatilla 200, one dose. According to repertorization result and comparative study from Materia Medica, pulsatilla 200, one dose is given. Repertory use synthesis repertory through radar software. This is the follow-up. The first follow-up, there was itching, skin eruptions all over body, especially on abdomen and limbs. I have given pulsatilla 200 single dose and SL for 15 days. Then again he come back on 27 5 2023. Itching reduce, no change in eruptions. I gave SL. On 11/6 he again come, itching reduce, eruption also reduce. I gave SL. On 26/6/2023, itching reduce, eruptions reduce. Here I give pulsatilla 200 single dose again, because he was saying, doctor please थोड़ा फास्ट कीजिए, जल्दी रिजल्ट दीजिए वगैरह, in that way. So I gave pulsatilla 200 single dose. On 12/7/2023, no relapse, itching reduce, eruption reduce. I give SL. On 23/8/23, itching reduce, eruption reduce. I gave SLs. And on 1/9/2023, exactly 1 year back. Now this is November, actually more than 1 year. There is no itching and no eruptions. So conclusion, from above case, it is clear that whatever may be the diagnosis, if proper selection of constitutional remedy is done, cure is achieved. Skin is the most vulnerable part for the expression, but that is a mirror of mind. What homeopath need to do is to look into that mirror so as to get result. On the basis of holistic approach, pulsatilla removed itching eruptions, and as there is no relapse of eruptions, so we can say, now it is almost 1 year, there is no relapse. So we can say homeopathy helps in psoriasis. So to find out, so with this we can find out constitutional medicine or simillimum. Simillimum need to know patient's physical makeup, mental makeup, and general makeup, so as to reverse the chain of illness and bring the patient back to normalcy. These are the references, and you can see the case pictures before and after. This is before and this is after. You can see This was psoriasis. Already diagnosed from the skin specialist, and he have taken the medicines, but there was no relief. So you can see here and see all clear. Abdomen you can see. Here you can see abdomen. Here you can see that all this hand, and here it is all clear. Thanks to homeopathy. Huh? You can see in this upper corner, the hand and abdomen is clear. See abdomen and hand. Here it is clear. You can see the back picture also. See here. You can see clearly. So thank you very much.
Yes. Yes, sir.
Yes, now.
It's really an excellent session, and you really show the beauty of homeopathy as you rightly point out that the skin is the mirror of uh, internal disorder.
Yeah, exactly. And we have to follow 204 and 205 aphorism, as well as we have to take a mental makeup, physical makeup, and general makeup. If we take all these three together, and if we properly understand the patient, we can easily get the simillimum or constitutional medicine. And with the constitutional simillimum, we can reverse back to patient to its normalcy. So
Yes,
this is the magic of homeopathy. So thanks
you
to homeopathy, sir. Now, anyone have any query,
because
any question?
the totality, you took the totality. That is why you observe the patient in detail, how the patient works, or how the patient expresses all these things. That's why you got the effeminate in the last case, and
Exactly.
that
Exactly. And sir, one more thing. I have taken in that one case is embarrassment. You know, embarrassment को कैसे लेना है हमको कि जब patient आता है और हमको when we ask that patient, tell me about your complaints, तो वो कुछ बोलता नहीं है. He will not say anything. वो he is showing his shy appearance, like
yes, yes,
this way.
uh,
This is elements from embarrassment,
yes,
like that. I have taken the effeminate, like normal. The male are entering. He is not entering like a male. He is talking like somewhat like a female. So I have taken the effeminate. So along with your mental, physical, and general, your observation is also very important when you have to find out the totality of symptoms. Then and then only you can reach to simillimum.
that the most of the some of the patients we used to fail because you people concentrate more on the particular disorder rather than the
Right.
personality. The individuality is to be looked, totality is to be looked. That is what you have. Uh,
100%. What
uh,
Dr. Hahnemann said in 204 and 205, that we have to look into totality. Then
that
only we can get the result.
that means that everyone should read at least one aphorism every day, so that that
100%, 100%.
uh,
Because it's our holy book, and whatever problems you are facing in your practice, if you go to the organon, you will get the answer of your questions. You will not get stuck up. So
yes.
whenever you have any issue, any problem, just open your organon. Answer will be there in the organon.
Yes, there was a question that whether you repeated or not. Frankly, you never repeated the medicine.
Frankly, I have not repeated. Only twice I have repeated. Whenever you come to Nasik, you can see that case paper is with me. I have the phone numbers with the patient. And as I told you, previously I used to repeat so many things, so many doses, so many drugs. But the moment I joined Saigal's method and Dr. Liaquat Namole, I got that confidence on the homeopathy
Yes,
and on the mind method, that there is no need of repetition. And frankly, that I have not repeated pulsatilla. Only two times I have given the pulsatilla, and now I have developed another practice. Whenever I want to repeat any remedy, I give the water dose. If I feel I don't have any confidence, then I give the water dose. Otherwise, I don't repeat the medicine.
that
Now I don't repeat the medicine.
you
2 years
mean,
back, I used to repeat.
sir? You mean LM potency or the same 200
No,
potency?
sir, I'm not using LM potency. I'm not
Oh,
using LM potency. Still, I have to. I think I need some time to jump on LM potency also. Now, I think the next step is LM potency.
if you won't get the result with the normal potencies, then there is no need of running
Yeah.
that way.
To the LM potency. We
Well,
don't need to go to the
most
LM
important,
potency.
the
But
most
whenever I want to repeat it, then I repeat water dose, these only, these regular medicines, centesimal and all this.
the most important aspect is to find the right remedy and then the right dose. Then,
Yes, and sir, one more thing is that you have to differentiate also. Rightly, you have to differentiate remedy also. Like I have differentiated with in first case lycosulfur and pulsatilla. Carcinosine is also there, but somebody said about carcinosine. But carcinosine should have long domination, long prolonged domination,
yes,
and
that's
in that case patient is not talking so much. Carcinosine patient will not talk so much about he is not bolstering. Carcinosine normally there is no bolstering. They will modest, they will be modest, they will not talk so much about their own creativity, about their own job or about their own profile. They will not talk much, they are not bolstering. Carcinosine are not bolstering, where lyco is bolstering. That's
yes,
why I have given the lyco in first case.
yes. It is the time for discussion, and those who want to participate in discussion, please raise your hand so that we will allow you to unmute yourself and you can speak to.
Yes.
I invite Dr. Marian Salceda to speak your opinion because she has a person who commented on Pulsatile, I think.
Yes.
Yes, Dr. Marian.
Mariama George, I think.
Marian Salcedo. Yes, yes, yes.
Hello, good evening, good morning to all of you. Thank you very much. This was an amazing conference. I learned a lot. And
Thank you,
I
ma'am.
totally agree that the skin is the mirror of the mind and also of the soul. So it was very interesting, this approach. Thank you very much, doctor. And I believe that you have many skills to make a big difference in the choice of the homeopathic remedy. And of course, that's a huge difference in the treatment and the answer of our patients. So thank you very much for showing these amazing results that you could have in the very challenging diseases,
Yes, thank
skin
you, ma'am.
diseases. So
Thank
thank
you,
you
ma'am.
very much.
Dr. Maria is from Bolivia, and now we invite Dr. Serbi from Turkey to say a few words.
And see, Dhanesh, sir, we need to show the evidence-based homeopathy. We need to keep the photos, we need to have a videos. Now in future, I'm going to take the video cases also, because unless and until you show evidence-based, then only people will believe on you. Otherwise, just reading the case and giving the remedies is not the way. You should have a proof, solid proof you should have, evidence-based homeopathy, what we call nowadays. Yes, please, sir.
Good evening. Thank you so much. It is a wonderful case, and Dr. Mukesh, and really, really wonderful result and I am thank you because we learn everything, a lot of things in this session. Thank you, IFPH, and you use it mainly one remedy and enough weight, and later repeat. It is wonderful, and you take a wonderful result. Thank you so much.
Thank you, ma'am.
Dr. JPC.
Think, sir.
Dr. JPC, you can speak.
He can unmute himself, I think.
Then it is up to Dr. Bob Lip.
Thank you. I'm Bob Lim from Malaysia. I would like to congratulate Dr. Mukesh for giving us a very, very deep insight into the title skin mirror of the mind and is cured by homeopathy. And he has dealt with the extract and code from the organon of medicine, which is the basic for all homeopaths to base their repertory and their diagnosis of the diseases. And he has done very well by differential diagnosis on each case. And That is very excellent case taking sharing tonight. Thank you very much.
Thank you, sir. Thank you.
Anyone want to add anything more or want to talk to Dr. Mukesh? Please raise. Dr. Jaykumar, do you want to speak? Dr. Jaykumar, please unmute. If you want to speak, please unmute. Dr. JP Singh, if you want to speak, you can speak now. You are muted already. Oh, so if sir, what is the present situation in your college admissions? How
Admissions are full, sir, as usual.
what
There
is
is no issue with the
admission?
admissions in Maharashtra. All over, the conditions of homeopathy colleges is good, no issue. And previously, it was like the students who used to pass out from the colleges, they used to practice allopathy. But now, thanks to Saigal method, thanks to Vijaykar method, Vijaykar sir, Saigal sir, then Rajan Shankaran sir, all these people, eminent homeopath from Maharashtra, they are imbibing homeopathy into the students' mind. And now the students are coming up and taking the approaches. And with these different approaches, they are coming together and practicing homeopathy. So as I am teaching since 22 years in college, I have seen that students are doing allopathy practice previously, but now since last 10 years, because of all these things, the students are practicing homeopathy. So condition is very good in Maharashtra nowadays, sir. They are practicing homeopathy because of all these eminent personalities. And again, thanks to homeopathy. So, and it has been said that all the rivers finally join to one sea only. So whatever methods, there may be different methods, like somebody will practice on your mind, somebody will practice on physical, somebody will practice on physical and general. Some are not taking mind or mentals. So all the methods all together joining, all the rivers coming to the sea and giving the results. That is very important, that we need to reach to the constitutional minimum and give the result, and our flag of homeopathy should be on the top.
What kind of admission going on in your hospital IP?
Cases, you meant to say what kind of cases are coming?
Yes.
Usually at my college is at in the rural setup. So the cases are of course skin and more of joint. So joint and skin are more.
Okay.
But in I think in city setup, where there is a city, the cases are of your of rare diseases also, like HIV/AIDS, autoimmune diseases, thyroid, and all those are also coming at city places. My clinic is at the city place, so I'm dealing with thyroid cases. I'm dealing with skin cases mostly. These cases I'm dealing more.
Okay.
But at my college hospital, the cases of orthopedic cases and skin cases are more.
Oh, definitely. That's good.
Yeah. Any other want to share, or any want to say something about the case, or anything?
Yes, just 3 minutes remaining. If anybody,
Yes. If we select the rubric, we might lend up.
Yes, yes, Dr. Sabakari, please raise your hand so that you can directly speak.
I think she wants to say that every skin patient is having the embarrassment. It is not so. It is not so, because if you see, whatever eruptions was there was hidden. It was on the abdomen and hand, and he was having the full sleeves. And so when it is not on the face, it is not on the fingers, there is no question of embarrassment. When of course it is on the skin, on the exposed part, then it may be the part of embarrassment. Here I have taken the embarrassment because of his gesture, not he told me that I am embarrassed because of this. Because of gesture I have taken the embarrassment, madam.
Yes, yes, totality is to be looked in all cases.
Right.
whenever you get the right medicine, you need to stick on the medicine and never try to add anything more or minus anything more. That is what.
Yeah.
So, what do you advise any food restrictions during your patient?
Actually, frankly, sir, I don't advise except coffee and onion. I don't advise any food restrictions to any of the patients, because in some of the aphorisms it has been said that whatever the cravings are there, those are again your is internal feelings. So when we are dealing with internal feelings, we should not have any restrictions to the patient. So normally I don't advise any food restrictions of any of the cases. Even if patient is having acidity and if he asks me, sir, should I take spicy or not, I said you can take whatever things you want to take. If you feel to take spicy, then only take spicy. If you have acidity and then you are taking spicy, it is not so. So I don't advise any food restrictions, sir. And nobody asked me about the doses. Normally, potency. Normally, I usually start with 200 potency, and then I go towards 1M, 10M.
Okay, sir. Thank you very much. I invite Dr. Boblin to say what are thanks to the session also.
So he's asking us skin and thyroid patient. What question is that, sir? This question is not clear.
Yes, it's skin.
Skin and thyroid cases. Which are the cases more she means to ask?
She's not explained anything more, sir. Simply skin and thyroid.
So not clear.
So when you ask want to ask a question, you just come out. Anyway, the time is over. I invite Dr. Marius. I'll say that to say vote of thanks to the session. Dr. Mariam. Dr. Bob, you can say vote of thanks to the session. Dr. Bob Lips.
Okay, on behalf of the IFPH, I would like to say a very big thank you to Dr. Mukesh Ambab for giving a very interesting and beneficial case taking on skin problems with homeopathy and completing the successful 1525th daily webinar. Once again, thank you very much. And
Thank you, sir.
congratulations. Over to you, Dr. Danish.
Thank you, Dr. Bob. Tomorrow we will have a session from Dr. Professor Baina Sharma, and she will be talking about art and skill of observation in homeopathic practice. With that, we come to the end of the day, 1525th. Thank you, Dr. Mukesh.